When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Oschner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. It's festival season, the weather's getting better, and we're going to be out in the backyard grilling a lot. And while we love to eat in South Louisiana, sometimes what we eat and choose to eat is not always the healthiest decision. We have three guests today that are going to be talking all about nutrition and how you can make better food choices to lead a healthier lifestyle. First up, we have Hailey Story.
Hi.
Hailey, how are you today?
Good, how are you?
Good. You are a clinical dietitian with Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital. Tell me a little bit about what exactly you're doing when it comes to nutrition and our patients.
So I meet with almost every new patient that's about to start treatment, and we look at their diet and talk about ways that we can make improvements on their diet while they're going through treatment. Healthy options, also really increasing their protein intake, because that's very important during treatment, whether it's chemotherapy or radiation therapy.
Now, kind of shifting gears just a little bit, overeating, of course, has become a problem. Obesity is a problem,
Yes.
not just nationwide, but especially in St. Tammany Parish. I know you work a lot with that and kind of help people overcome that hurdle. Tell me a little bit about what that involves.
Well, it's very hard to treat obesity and to help patients overcome those barriers, because there's so many different factors that play into obesity, which include our genetics, our environment, our community, all the drive-thrus that we have, just the fast-paced lifestyle that we have, also our emotions, the medicines we take. So it's a very large approach that you have to take with each patient, and it takes time. It's not something that can be done within a month. It's more of a lifestyle change and just helping those patients identify what's causing them to overeat, or because obesity is when you start to consume a chronic amount of calories, consuming them, but not expending the energy and burning those calories off.
Right. Well, what is one of the easiest ways that people can maintain a healthy weight? Not just lose weight, but maintain a healthy weight and make good choices.
Try to eat whole foods, so your fresh fruits, your fresh vegetables, whole grains, beans, lean meats. Something not easy to remember, but something to keep in mind when you go to the grocery store. Try to shop the perimeter of the store and stay away from the inside aisles, because those aisles that's where you find all your processed and packaged foods that aren't as healthy for you. So try to shop the perimeter, but also try to adapt a healthy lifestyle of 30 minutes of physical activity a day. And even if you're not physically active, just making small changes, whether you park further out in the parking lot and walk into work, or taking the stairs, maybe taking the longer route to get to a different office if you have a desk job or something like that.
Yeah, and I've actually tried to do that at the office recently. Instead of taking the elevator 3 flights or 3 stories, I'll just take 3 flights of stairs.
Right.
Getting back to the grocery store real quick, I know one of the things that I found interesting in the past couple of years is washing all of your fruits and vegetables,
Yes.
whether they're fresh, frozen, canned, whatever.
Yes.
What's the importance of that?
Well, fresh fruits, fresh vegetables, it's important to wash those, just because they go through a long line of transportation and they're handled by multiple different people, so it's best to wash those. But also it's important to wash your canned fruits and canned vegetables, because they're packed in water with sodium, or concentrated fruit juices. So it's important to wash those, because that's just extra calories that we don't need.
Right. And you see a lot out there too about buying fresh can be a little bit more expensive.
Yes, it is.
How can people make these healthy food choices on a budget?
Well, it's best to eat fruits and vegetables. If you're looking to buy fresh, buy the fruits and vegetables that are in season, because they will be a little bit cheaper. Also, buying your frozen fruits and frozen vegetables, there's nothing wrong with that because they're actually picked at their peak of ripeness and then flash frozen, making them just as healthy as your fresh options.
Right.
But make sure you stay away from any fruits or vegetables that are packed with any syrups or sauces, because that's just unnecessary calories that you need. Make sure you're just buying you know, the vegetable and not something that's has sauce or anything in the bags.
One of the things that has become a problem in making these food choices in today's world is portion size.
Yes.
And that's one of the things I know that you are really passionate about and talk a lot about. Kind of a two-approach question here, but portion distortion is kind of a buzzword that's been going around lately. Let's talk about a little bit what that means and what's kind of happened in today's world when it comes to food.
Okay. Well, over the past 20 years, the portion sizes have gotten larger, have increased substantially. So 20 years ago, if you would go to a cafe and order a muffin, it would be 1.5 ounces, yielding about 200 calories. Now, if we run through PJ's or run through any coffee shop, the muffins that we get are about 5 ounces, and that's 750 calories, and that can be half of somebody's daily intake of calories.
I can barely finish it usually.
So, I mean, I know I can finish it. So, you know, it's just all about portion sizes, and what has happened is our thinking of normal size portions is now distorted because we think that a 5-ounce portion is a normal portion. But some easy ways to you know, making sure that you either cut it in half or you're selecting the right portion size. I use these little tips of household items or something like that. So a CD is a good representation of the size of a pancake or a waffle that you should eat. A chicken breast, one serving size is a deck of cards. Your fist is a serving of cereal. A tennis ball is a good representation of the amount of cooked rice or pasta that you should have on your plate.
And you're right, portion distortion, you think of that and you're like, that's all that I'm supposed to eat. I probably eat 3 fists of dinner, you know?
Exactly, exactly. So it's just all about keeping those little references in mind when making your plate or portioning out your foods.
And that's something that's worked for me recently is if we go to a restaurant, of course restaurants are notorious for over-serving you.
Yes.
I'll sit there and I'll divide it and just push that aside.
Yes.
What do you have any other tricks for people if they go out to eat, kind of?
Sometimes, because a lot of times a dinner plate is enough for 2, sometimes 3 people. So you could either share with whoever you go with, or you can ask them to, you know, only put half on the plate and put the other half in a box. So you're not even tempted to eat any of that. Right.
What, kind of getting back to maintaining that healthy weight, what other, you talked about how you can shop appropriately in the grocery store. What about cooking? I know you do a lot of cooking segments with the Cancer Center. How are you explaining to people cutting the sodium, watching out for sugar, stuff like that?
Well, cutting the sodium, everything has sodium in it. A lot of the, when I do my cooking segments for our patients, a lot of them are your fresh fruits, your fresh vegetables, or your frozen fruits and your frozen vegetables. But sometimes I'll have to add some chicken broth, or I'll have to add some diced tomatoes to my soups or, you know, my dishes. And when I do that, I never add salt to when I'm cooking. And if the patients want more salt, then I'll have it on the table. But just to show them that it's really not necessary to add extra salt while cooking, because it's all about letting those flavors simmer in the pot and kind of marinating. And also, I use a lot of fresh herbs and spices from in my recipes to really bring out the flavor of the foods.
That way you're getting your fresh vegetables.
That's right.
So,
that's right.
Well, Hailey, thanks so much. Always a pleasure having you. When we return, we'll talk about proper eating habits and how snacking can actually be good for you.
For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're talking all today about great eating, healthy eating, and clean eating, which is the cornerstone for preventing so many of today's health issues. We're joined today by Elena Benezech, a registered dietitian with Oschner Health Center-North Shore. We're very excited to have you here as part of our regional clinical partnership with Oschner Health System. So we're glad to have you.
So glad to be here.
Tell me a little bit about what you do with your patients.
Okay, well, I'm an outpatient dietitian who works with the new bariatric program under Dr. Gridley in Slidell, and I really work with the patients on their weight management goals before and after surgery, and also just with other people on their weight management goals as well.
Now, one of the things that you work with them on and really kind of drive home is one of my problems, which is snacking.
Yes.
And snacking isn't necessarily a completely bad thing, but I know that you have a whole range of issues with snacking, so I'll kind of let you give us a little introduction into that.
Okay, well, basically what happens is a lot of people eat really well for their 3 meals a day, but it's really the in-between foods that we eat that really can wreck our diet. It can cause us to gain weight and also make it really hard to maintain weight. So an example, so you get to work after you ate a really healthy breakfast and all of a sudden a big box of donuts walks in. So what are you going to do? It's really hot, everyone's eating, you're going to grab one. So after that, a couple hours later, it's in the break room still, so you grab another one. So already you consumed about 500 calories just in that mid-morning snacks. So you go off to lunch, you choose some healthy options, and then you're at work at your desk and you're exhausted. It's 3 o'clock. You're like, you know what? I need some orange juice to kind of liven up my day. So you go to the vending machine, grab some, and you think you did pretty good. But looking through the whole day, work day at least, you got an extra around 700 calories just from snack foods. And that's equal to about less than half of what we need in a day. So that's really adds up super quickly.
Now, one of the things about snacking that's important to remember is tracking your snacks. I know one of the things you do is a nutrition log. What's the benefit and the importance of actually tracking that? Because it's so hard to remember, okay, I put this in my mouth, I got to write it down. But there is a true benefit to doing that.
There is. It's something called mindless eating, and a lot of people do that. What happens is that, you go throughout your day, all of a sudden you see some food, it's there, so you eat it. Or, you're not really hungry, but you just formed a habit, such as when you're watching TV, you eat. So it's all these little things, and they start to add up. So by tracking it, which you can kind of see on the screen, there's a log, and this person wrote down everything they ate for the day. We're going to focus on the snacks, and specifically, I like my clients to write down why they snacked, because that's kind of going to help us look at why they're doing what they're doing. So as you can see, the first snack that the person eats, the reason is they're hungry. That's a great reason. In between snacking is not the most awful thing that you can do. It's actually a good thing. But you see the next snack that kind of adds in is because they're watching TV. Not the best option. And then the last thing they wrote in the additional comments was they ate 5 Snicker bars at work. The mini Snicker bars, but still,
they add up.
It does. It adds up quickly. So what you want to do is you want to track what snacks you're eating. I always say 1 or 2 times a week, just to kind of see where you're at, and you can kind of divide it out and say, yes, I was eating because I was hungry and I was picking healthy snack options, or I'm kind of just mindless snacking. I need to really work on that. And so that can kind of help you get to your weight loss and management goals.
Now, a lot of those fad diets that are out there, trend diets, whatnot, are pushing you to eat a lot of meals throughout the day, more than just your 3. And of course, people hear all the time, you really should be eating constantly to keep your metabolism up. That's where I guess snacking comes in, that it's not a bad thing if you snack correctly. So what is the value of eating more than just those 3 meals a day?
Well, the value is that you can actually eat less during your main meals. Because what happens is if you don't do any snacks throughout the day, you kind of run the risk of being starving at mealtime. So when you feel starving, I don't know about you, but I just want to eat the kitchen sink.
Right.
So you're going to want to eat everything, and that's going to increase the amount of calories you eat. You usually eat quicker, so you're not really in control of what you're eating. As opposed if you had a snack in between meals, that's going to kind of help tide you over, help you make better decisions as well for meal times.
And it is about 5 to 7 meals a day is what I say meals. 5 to 7 servings is what you should be eating?
I usually say around 3 meals, and depending on your activity level as well, between 2 to 3 snacks.
Okay. Now, we keep talking about snacks. What should you be eating during a snack? Because we're going to eat. It's just human nature.
Absolutely. And what you really want to work on is trying to clean up your snack routine. So we kind of have some tips and tricks. So the first thing that we really want to do is eliminate temptations. So if you have boxed boxes of Oreos, you know, in your pantry and all kind of the junk food, you're going to eat it because it's there. So the first thing you can do is really clean out your pantry, clean out your desk, and try to get those foods out of your house. Those prepackaged foods aren't the best thing for you. The next thing that you can kind of do is prepare yourself. You know, in life, if you're prepared, you're more likely to face the challenges head on. That's the same thing for snacking, you know. So when you go to the grocery store, grab a whole bunch of good stuff for you, and then as soon as you get home, make the healthy food convenient. How do you do that? Prepackage it. Right. So, you know, prepare everything in advance, put it in Tupperware, put it in bags.
That's been a big hurdle for me, but it has worked. You're absolutely right.
Yes.
On a Sunday, if we can sit down and make a menu, you know, I can bring my bag of goodies to stock my desk drawer for the whole week.
Exactly.
Instead of, oh, I need to run to the drugstore to get a bag of chocolate or something like that. So getting to that point of being prepared was difficult, but once I had it set up, it made it eating healthier so much easier.
Absolutely, and just kind of comes a part of your routine, and that's what we really want to do. The next thing we kind of want to do is include protein, because often what happens is our snack foods, let's think about it, it's the cakes, the Chewies, chips, all foods that are basically carbohydrates. If you add that protein into your meals, into your snack meals, what that does, it helps you keep fuller longer. So some examples are kind of on the screen. You can do everything from like deviled eggs to Greek yogurt to some fruit and cheese, and there's a couple other things on there too. So just having that actually helps fill you up and prevents you from craving some other food, you know, an hour down the line and kind of ruining your snack budget.
Now, we are in festival season. We are in high gear. We're going to be eating a lot. We're going to be eating a lot on the go. Right. We're going to have barbecues. People are going to bring dips and chips and everything. How do you survive the weekends and festivals? You know, I notice, at least during the week, we try to eat really good. Pants start to feel a little looser by Friday. Monday, I'm terrified. Right. How do you get through that?
Okay, well, we all know we're going to festivals and parties, all those type of things. We kind of have to think of some tips and tricks to kind of help us through. The first thing is, wherever you go, check how your food's being prepared. Okay, what we want to be picking are baked items, grilled items, roasted items. Those are cooked with less fat, so it's healthier for us. Our fried foods that are very common around here aren't the best thing for us, so we don't want to be eating that all weekend because it can definitely make those pants a little tighter.
I can have a little taste though, right?
Yeah, a little taste, absolutely.
It's all about moderation.
It is, because again, there's going to be some great things out there, so on the festival scene. So when you indulge, try to indulge in moderation. Share with a friend, or, you know, pack half of it and throw the other half away, or just, you know, give it to somebody else, or just kind of set aside with yourself that, you know, I'm going to pick one thing that I'm going to kind of indulge in, and the rest of the time I'm going to try to eat healthy. And what you want to do is, when you're eating healthy at these festivals or parties, try to incorporate the vegetables and also the protein on your plate, so that way you know you're kind of getting a well-balanced meal.
Well, it'll be difficult, but I will have to force myself to split my crawfish bread now.
Yes, that's the best option.
Well, Elena, thank you so much. Glad to have you here. And when we return, we'll be talking about what happens when you're not getting the right nutrition, but how you can resolve that issue.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Oschner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're talking all about good eating. We've gotten some great tips on how to snack right, how to shop right, how to cook right. What happens, though, if you don't do all that, can lead to some big issues, one of those being malnutrition. We're joined today by Michael Sanchez from St. Tammany Parish Hospital. You're a part of a cardiac rehab team, but you also deal with some of our nutritional issues. We're glad to have you here.
Thank you, Christian. Nice to be here.
Want to explain a little bit about what your role is when it comes to nutrition at the hospital?
Well, nutrition is a big part of cardiac rehab. We do a lot of education. We also work with the dietitians. We actually have a block education program every couple of months where we bring the dietitian in, talk to the patients about healthy eating and problems with malnutrition. It's very important to cardiac health as well as pulmonary health, kidney health, and pretty much every area of the hospital touches on diet in some way to try to get people healthier.
Now, I know we were talking earlier in the show about how to eat fresh fruits and vegetables, how to snack, what you should be eating, clean eating. Sometimes that's not always an option for a patient or even just an individual at their home. You know, you walk into Sam's, you see these commercials for yogurt or Ensure or Boost. Nutritional supplements are a huge part of healthy eating and proper nutrition. Talk a little bit about what those nutritional supplements actually are.
Nutritional supplements are formulas that are brought together. They try to get the proper nutrition for the different health areas in the smallest amount of volume possible. Malnutrition is a very big problem. About 1/3 of the patients we admit to the hospital every year are clinically suffering from malnutrition. What we do is we screen them. We try to get them in there. We use our nutritional advocacy program to try to get the dietitians in there. They prescribe the oral nutritional supplements. Just for example, they're very good in the hospital. The studies that we've done have shown that just a 1% increase in the use of oral nutritional supplements can decrease the length of stay of a patient by up to 21%. It can actually aid them in their healing process. It reduces their exposure to sepsis and infection. Ensure is a very popular formula that's pretty much general nutrition for most of the population. We actually have programs now that can give Ensure to people that don't have it. There's a lot of coupons available. There's actually a government program if a patient is prescribed Ensure. We have a program where they can get a $60 credit each month towards purchasing the Ensure. We also have substances like Glucerna, which is good specifically for patients who have diabetes. We have Nepro and Suplina, which are for patients with kidney disease. Generally, all of them are formulated so, once again, they give the proper nutritional balance in the smallest amount, because a lot of people, especially elderly patients, just don't have a great amount of appetite.
Right.
It's very hard to get them to eat enough. So we try to get what they're getting. We want to make sure it's good nutrition. And
you know, I actually tasted a couple of those at a recent health fair, and they're really not as bad as what people think they are. But this isn't just for the hospital setting. For somebody of a certain age, like you were saying with appetite, this is probably something good that you should be using these oral nutritional supplements at home.
Yes, there's been a big uptake. You'll see commercials on TV about Ensure and the various things. Pediasure is another one, people talking with childhood nutrition. Mm-hmm. A lot of children these days just don't get the proper nutrition, and they're being used in the home a lot more. As you said, the taste used to be pretty much chalk, and that's pretty much. But they've got a lot of really good flavors now. We do, at some of our health fairs, we'll actually have little tasting things, little shots, I guess you could call them, little shot cups that we use, and people taste it, and they're just amazed by how good some of these things taste.
Now, you talked about proper nutrition and malnutrition. What are some of the implications of malnutrition? What are we looking at when you reach that point?
Malnutrition can cause, as I said, it causes impaired healing. For one thing, anything the body has, whether it's an accidental injury or surgical incision, the body needs protein and the proper nutrients to heal. So therefore, it delays their healing. In the case of infections, it makes you much more susceptible because it impairs your resistance. You're much more commonly going to have infections, and when you get them, it's very hard to get rid of them. The body can't fight them off, and they can wind up in septic shock. People who do not have proper nutrition tend to have a greater problem with falls, especially in the elderly patients. They're not as sure on their feet, and of course they can wind up with all the other injuries that are related to that. It causes cognitive function problems. Especially in children, it's shown that if you don't get proper nutrition, it can actually cause cognitive deficits that can extend throughout life. Mm-hmm. Some of the others, it impairs cardiac health, pulmonary health, and kidney health because they're just not getting the proper nutrition, and that can result in a lot of a sequela of problems that just develop from that, and they can wind up much sicker than they need to be. And
we've talked a lot on this show about what kind of foods to eat and how to eat those foods in moderation and whatnot. You're talking about, like you were mentioning just now, the nutrition, how to get the proper nutrition. And I know you have some not secrets, but tips and hints on how to properly make sure that you're giving yourself proper nutrition.
As Hailey and Elena both were saying, a lot of people don't realize that the old 3 meals a day are not really a good thing. We do recommend 5 or 6 smaller meals a day. We recommend that you get at least 5 ounces of good lean meat, such as lean meat, chicken is ideal, or fish at least every day. We recommend you eat at least a cup and a half of colorful fruits and at least 2 cups of vegetables. So a little thing about you saying about taste the rainbow, it's kind of a good thing about that. The more colorful, the more different colorful foods that you eat, you're going to be getting better nutrition,
right,
more nutrients of different kinds.
Plus it's more fun.
Oh yes, definitely, definitely.
What other secrets, or not, I keep saying secrets, there really shouldn't be secrets, tips to nutritious eating do you have though? Another
one that we touched on about eating a heavier meal early in the day. I know it's traditional, Americans especially, we have a tendency to skip breakfast altogether and maybe eat a light lunch or go eat something at a fast food restaurant and eat a really big dinner. It's pretty much the exact opposite. There's an old saying about that for good health you should breakfast like a king, eat lunch like a noble, and eat supper like a pauper. And that is true, because if you eat the heavier meal later in the day, it tends to go into storage, it tends to go into fat. Your body doesn't use the nutrients properly. If you eat a good breakfast in the morning with all the nutrients, your body uses it during the day, and it's much more efficient to do it that way.
Right. We're wrapping up our show today. A ton of great information on nutrition and healthy eating and clean eating. If I were a patient, what would be the top 2 or 3 take-homes that you want me to know about getting proper nutrition and avoiding falling into that malnutrition category?
Well, once again, trying to eat consistently throughout the day, eat proper meals. Do not overeat. I have to repeat what Elena said about getting rid of the junk food. Stay away from empty calories. For instance, sodas, even the diet sodas tend to be a lot of empty calories, and they're not good for you. And then just trying to maintain it. Once again, you're always, don't get dismayed if you fall off the wagon for one day. If you go ahead and eat a whole box of Oreos one day, or like Girl Scout cookies as we've had recently, it doesn't mean you're going to continue to do that. If you have a bad day, the next day maybe make up for a little bit, but remember, you can't fast the next day to make up for it. You need to eat healthy every day, because that's the way your body is. If you try to fast, your body goes into an emergency mode and you wind up, it starts trying to store stuff when it really shouldn't. So it's not a good thing to do that.
All right. Well, Michael, thanks so much for being here today. Always glad to have you. Glad you were tuning in today. You can always find out more information about healthy eating and a whole bunch of other health issues on our website, stph.org. You can also follow us on Facebook, LinkedIn, Twitter, and Instagram. Until next time, thanks so much.